Make no mistake about it, we are still in the middle of a pandemic. And we're talking about healthcare workers because a lot of Filipinos work in the healthcare field. We call them our frontliners, but they really are the last line of defense. And so if they collapse, then you get the picture, right? And so we've been talking about the struggles of nurses, Filipino nurses, healthcare workers here on the show. And we have honored them as well with a tribute video. But you know what? The real honor to them is not those videos, but really to try to keep them safe and alive as they do their jobs, as they work to save patients that are dying from COVID. The healthcare workers are just doing their jobs. They shouldn't be dying as well along with the patients. And that's what we're going to be talking about right about now with two very inspiring Filipinas of power that are using their influence to create Kanlungan. Joining me right now on the show are two community leaders, esteemed leaders in the Filipino American community. Joleen Leavitt is a community and labor organizer for the last 17 years, a firm founding chairperson, union organizer with United Teachers Los Angeles, social worker, daughter and granddaughter of immigrant Filipino nurses, and a firm international committee. Joining her is Ninotchka Rosca, who's an award-winning novelist, journalist, former political prisoner under Marcos's martial law. Founded a firm organization in its original orientation in 1989, and also a member of the Affirm International Committee. Hello, powerful Pinays! Welcome to Jannelle.
Thank you for having us.
You guys, both of your work I'm familiar and very inspiring, and it's nice to know that you are still at it. What do you get out of it?
Once in a while, we actually win. It makes everything worth it. So maybe once after, I don't know, a few thousand hours of work, we'll win, and that makes everything worth it for me.
Ninotchka, I'm also such a fan of yours because I know that even before, when I was interviewing you on my old show and hearing about you and your work, I know that you've never wavered in fighting against social injustice. And see, you don't have to do it. What keeps you going?
I am a philosophical Buddhist. And so this is my dharma. This is the essence of my existence. To fight for what is just, to fight for what is right, and to leave the world a better place than when I found it. So this is the absolute commitment to duty. Absolute. Wow. Also, life would be so boring otherwise.
No, your commitment is very inspiring to me, and both of you have given birth to Kanlungan. We're going to be talking about that today on the show. I guess the first question is the story of your aunt, Rosary Castro Ollega, right? Joleen, she's the first health worker to die of COVID-19 in Los Angeles County. And because of her death, this gave birth to Kanlungan. Can you tell us a little bit about her story?
Sure. So Rosary Castro Ollega was the first death of a healthcare worker here in LA County. And she passed away, I believe, the first or second week that we were social distancing. However, it wasn't until maybe the 7th or 8th week that her name was said publicly. She and my mother worked in the ICU of Cedars-Sinai for over 20 years together before she retired. She actually came back with the pandemic. She came back, she wasn't working at Cedars, she was working at other hospitals, but she recognized the need. And so that's how strong the calling was with her. She and her twin daughters actually fell ill, and she subsequently passed away, leaving 3 daughters behind, and her twin sister, who's still currently practicing as a registered nurse. They're Pinay. They actually went to high school here in LA at Franklin High School, but they studied college for nursing in the Philippines. And when they were not named, when their family was not named, when Tita Rosary was not named, I realized that it was actually our responsibility to document their stories. No one was going to do it for us.
And what struck me about her story is that the commitment of being a healthcare worker, the commitment of being a nurse, because she was already retired as of 2017. And when this thing broke out with COVID, she came out of retirement in order to serve. And I know that that's not the only story that's touching with your collection of Kanlungan. So Ninotchka, how difficult or easy was it to start an online memorial?
Well, Joleen called me at the time when I learned that one of my closest friends had COVID. And my daughter works for Medicine Sans Frontières in Germany, and she was dealing with COVID absurds in Central Africa, helplessly, yeah? And so I felt so helpless, wanting to help, and at the same time, because we were in quarantine, I'm in the epicenter of the epicenter, Queens, and every 5 minutes, you hear the ambulance sirens. So it was really totally stressful. So how do you articulate? How do you express? How do you enable the community to do its collective mourning for people who got sick, for people who are dying, for people who have died? And so it was in this huge welter of emotions that Joleen and I were talking about this. And it was difficult emotionally, but once we made the commitment, we had the concept down, then we just went, zoom really fast on it, because we wanted this to become a public issue. And you talk about the commitment to healthcare. This stems to pre-Hispanic traditions, where the women were the healers. I mean, people tend to revise that history and say, oh, the other genders were. No, it was the female of the community that held the power of healing. And so a babayla, a priestess, she could be a priestess without being a healer. But a healer was always a priestess, always. So this is not just profession, this is a calling.
When it's so close to home like that, Joleen, you knew your Auntie Rosary, you have health workers in the family. I'm sure there's fear there as well. And Ninotchka, your daughter, and I was having goosebumps just you explaining how every 5 minutes you're hearing the siren of the ambulance. I mean, I can only imagine, and that's already difficult. And then to form an online memorial, it's a little bit like reliving the pain as well. And I'm sure that's a challenge with you guys as well. Joleen, what other challenges did you encounter? And when Ninotchka said as soon as you guys committed and did it, how long, how many days after, or maybe weeks, or maybe hours from the time you got the idea to the time the website was live?
Ninotchka and I convened a very talented team, almost all women. They included Grace Regulano, who's actually the research director of United Teachers Los Angeles. Very, very, very talented researcher. Charlene Sayo, who's based in Canada, also a journalist, a writer. Charisse Nadal, who is also trained in higher education. and she compiled all like the historical background and research that you see on why the tab, why they came. Iris Boncales Strauss actually stayed up for days and painted all the artwork that you see on the website. Sai did the architecture of the website, as well as Cheryl Zarate, who's also in a firm. And, you know, we worked in the morning before we did our paid work, and at night we did it on the weekends, and it took us 4.5 weeks to compile the website. And some of the particular challenges related to what Ninotchka was saying was we had several breakdowns putting together the picture gallery, for example. There's a process that I think a lot of us are familiar with. When someone passes away, you pull photos of them where they're in their joy, where they look the best. And so we ended up, without knowing it, emulating that process, going through photos of the deceased, trying to find the photos that would capture them the best without even knowing them personally. So that was a difficult process. In some ways, because of the subject matter experts at the table, that part of the process was harder than, for example, creating a global map of where everyone passed away, or combing through and making sure we had at least 3 sources before we added a name to the website. So that's a little bit of the process that we went through, but it came together pretty quickly. 4.5 weeks is pretty quick if you look at the different layers of knowledge that's provided on the website.
And that's what I was going to ask next. I am sure that the rewards now outweigh the challenges. What are some of those, Ninotchka? Could you share some stories from the families or individuals that you're honoring? Or anyone, I'm sure they've expressed gratitude that you're doing this.
As I mentioned before, a healthcare worker is staying with me. It was in the middle of the pandemic. It's difficult to find another place that will allow you to stay. So people were really frightened. But anyway, he went through the Kanlungan website, and he said he found his classmate. And then we get notices. Because not even the unions would say this nurse was from the Philippines, or the hospital would not say this fellow who was driving the ambulance was from the Philippines. Well, it was really an erasure of the value of immigrant labor through these countries. And so we get this feedback, and then suddenly I get 2 messages from a hospital in England saying 2 Filipinos died. You know, I was like, wow, at least they are not invisible anymore. We made this sector of our community visible. That is a great reward.
And that's so touching, because these people are selflessly, I've heard of nurses, Joleen, you can relate maybe because you still have a young child as well, nurses who haven't seen their toddlers, their babies for months because they have to quarantine, because they're working at the hospitals, because they want to be there and help. But and some of them that are getting affected, I've also interviewed some, when you get affected, you're essentially on your own. You quarantine by yourself. Sometimes they don't even provide food. They're not provided food. They have to look for it themselves. They have to rely on their families for that. And I'm sure there are other stories that are now striking you as you hear of these people that have passed in line of service, to save people from dying from this virus. Joleen, can you share some of those stories? Any stories that have struck you?
The first story that actually really upset me was that of Celia Marcos, who's based here in Los Angeles, who she sounded the alarm. She told the hospital management, administrators, the hospital corporation that they didn't have enough masks, that they didn't have enough PPE. And then she became one of the first casualties of the pandemic here in LA as a healthcare worker. So her story is well documented, and I think people should read it. It's also linked onto the site. And then there are some that I don't know their full story, but I had a really hard time while compiling their tribute. They're part of the tribute. There was a nurse in the UK named John Eligos, and he was only 23 when he passed away. So his face really popped out at me because he looked like he could be someone's very young son or nephew. And I can't imagine studying your whole life, finishing college just a year out of college, and then serving as a nurse in another country and passing away because you didn't have the right safety equipment as a worker. That's basically what happened. And I actually think about him a lot because I wonder who his mom is. I wonder what happens now, is his family in the UK? It doesn't seem like he'll be able to be laid to rest in the Philippines where his family is from. So there are stories like that. And then another one that really upset me was Arlene Aquino, who passed away here in the Valley. She's a single mom with 2 kids. Her and her kids, they came here. They lived in a small apartment with their grandparents. So there's 5 of them in a small apartment. She worked really hard to get a tiny house in the Valley, in the East Valley. And then she passed away from COVID. Her father passed away, her mother passed away, and now there's 2 children without any guardians. A lot of the stories are like that because we depend on the healthcare workers in our families so deeply, whether or not they're physically with us or back home in the Philippines. There's so many stories like that. There's a husband and wife that passed away in Chicago. I mean, you can't separate them from their stories, but those are some of the stories that really hit me hard as someone researching for the project.
I know, Ninotchka, that it's upsetting, it's sad, but you can't help but get angry as well, because these deaths could have been prevented had these healthcare workers gotten the protection that they deserve.
Totally. I am enraged. I mean, not just angry, enraged. Because number one, in the home country, my first cousin was chancellor of the School of Medicine of UP. So all those doctors who were dying were likely her students. I studied with her. And her whole family, she has a family of doctors. All of them, even the in-laws were doctors. So I'm watching this absolute waste of skill, just for lack of appreciation.
Support, right?
Lack of appreciation, lack of support, lack of value for the work and the talent and the skills, beginning in the home country and stretching all the way, around the world. It's such a common experience globally. It's disgusting. I am totally enraged, really.
You know, we count on our healthcare workers, on our nurses to keep us safe, to help us when we're sick. And so now is the time that they need to know that they can count on us as well for helping them do their jobs safely. Also, they can count on us for fighting for them in order that they get the right support and the proper protection as they fulfill their jobs in hospitals and healthcare centers. We are going to be continuing that conversation, but I just want to make mention as well that this conversation, this segment about nurses and giving information and honoring them is being made possible by the support of Toyota. Toyota is such a great company that they are making it possible for our community to champion the nurses amongst us, the healthcare workers amongst us. And Toyota wants us to know that we can also count on them. If you are looking for a vehicle that you can count on, and I can attest to this, and they are having incredibly low APR on or interest rates on all their hybrid models up until today, all through June and up until today, July 6th. So if you are looking for a vehicle that you can count on, trust Toyota to give you that service. They are having incredible deals on all their hybrid models. So that's RAV4, that's the Prius and Camry. So call your local Toyota dealer now or check them out online. We'll be back with more. Don't go away. I took particular interest in your project. It was sounded off to me by Faye Coons, also an organizer in Carson, California, and she told me about this, and I did a tribute for healthcare workers. My brother was a nurse himself, and he when this happened, he started taking on other jobs as well as a nurse. Up until that point, he was living with my parents, but he took it upon himself to leave my parents' house and rent a place on its own, so he doesn't expose my parents who are at risk. But even when I was talking to him, he had to pay for his own room. There's no support. We ask him for stuff. My sister has sent him some equipment, like protective gear, to help him. But even then, he said some of the hospitals don't allow nurses to bring their own stuff, but then they don't get the support. And this is what's important about Kanlungan, because you're not just doing it for the humanity of it, to give a place, a platform for grieving and mourning and honoring these health heroes, but you're also doing it for the science behind it, for the fight behind it. Joleen, can you explain that to us?
You summarized it perfectly. So this was to properly honor the dead, but it is also a tool for what we hope workers will utilize in their collective demands for dignity in the workplace. When we talk about worker rights, this is what this is. If all the nurses in California, 1 out of 5 are Pinay, if all the healthcare workers in New York, what's the statistic, Ninotchka? 34% are healthcare workers?
But 20% of all healthcare in New York, nurses, are Filipinos.
If you kill our people, the healthcare system will collapse. But why do we have to wait for that? Why do we even have to present that statistic? In order for employers and hospital corporations, long-term health facilities to give proper protection to the people that are serving the patients of this country. Why? I've been engaging in healthcare campaigns for over 12 years, and I know that we need data in order to wage campaigns comprehensively. Nothing is going to take the place of collective worker power, but it can't hurt. And so we did that very mindfully. We want a place where people can share their stories. We want a place where people can actually trust that the data is whole. And we want to make sure that this is also a tool for organizing the workplace. No one is going to give our healthcare workers what they need out of the goodness of their hearts. And we see that with over 80 deaths here in the US alone. And so it's our responsibility as a community to create those resources for ourselves. So Kanlungan is a memorial meant to honor our healthcare workers the way they deserve to be honored, and it is also a call to action. And with resources, it's not an empty call. We are very, very purposeful in what we've included throughout the website.
What is your elevator pitch, so to speak, for Kanlungan? If you were to invite the viewers right now to check it out, why should they check it out? What will they get out of it?
People nowadays forget that in the 1980s, our nurses, our healthcare workers were brought here as temporary workers. And after 5 years stay, they were told to go home and to stay for 1 year and reapply. So they lost their seniority, they lost their benefits, they lost everything. I was involved in the struggle to get permanent residency for our healthcare workers. Even at that time, you know, we were already battling this. 1989 to 2019, that is a very long time to still keep having to fight for your rights and for for justice. So this is what I hope that people who access the website will understand, that one small victory is not enough. Either we win all or we are going to keep on dying.
And that's what I want to make mention as well. We've also heard this, I've heard this before, what our health workers, Filipino nurses and doctors and people in the health industry that are working right now, we say they're on the front lines, but really they're not. They're our last line of defense. And if they collapse, then there's no defense. And what they need as a tribute is not, empty. And I know I did this. We asked for people to send their photos of their friends and families who work in the healthcare industry, and we did a video tribute for them. And I know that more than the video tribute, this is exactly what they need. Something like Kanlungan, because there's no point in giving them a tribute when they're gone, although it's good to honor their memory. But what we really need to do is to keep them alive. And the way to do that is to keep them safe. Joleen, with all the following, the traction that you're gaining with the website, has it affected any change at all in any of the hospitals, in any of the cities? Has it started a dialogue? What kind of effect has it brought about?
First and foremost, we've opened dialogue with healthcare workers that are currently struggling for PPE. I think that that's, to me, as an organizer, I'm biased, one of the most important things. Secondly, we've gotten many notes from family members of those that have passed, providing the names of their loved ones who are nowhere to be found in the media. There's a lot going on in the world, and it's easy for the deaths of our people, of healthcare workers, Philippine healthcare workers, to be secondary. So there's a lot of communication around that. And I think third, other advocates and organizers and researchers have also reached out, both here in the US and globally. For example, one of the top medical administrators for the UN's health arm, thanked us and also passed it on because it's a useful tool. So there's like a mix of both gratitude for properly honoring the dead, and then also people that are working to keep everybody alive, confirming that the data has been useful in their own realms. Even down to one family medicine doctor and educator here in Los Angeles actually thanked me because he's teaching med students who are in the hospitals, and they used our website as a teaching tool to understand the impact, the disproportionate impact of COVID on not just patients of color, but providers of color, which are the Philippine healthcare workers.
With that said, I think this memorial also underscores the real threat of this coronavirus, that we are still fighting. We are still in the middle of a global pandemic. It is highly contagious, right? And it is very deadly for many. And with the recent spikes in cases, deaths now hitting closer to home, by now you probably know someone, friend, family, acquaintance whose life has been claimed by this. What message would you like to impart to the viewers? Let's start with you, Ninotchka.
Well, for the Philippines, people should be aware that they are on their own. Government has no plan with regards to the pandemic. They had to take care of themselves and to take care of one another, and to set up systems that will enable them to survive. In other words, for them and for us, self-reliance is still the best principle.
What about you, Joleen? As a parting message, I guess it's, 4th of July weekend. Some people, what I don't understand is how some people can take this lightly. How I see people walking down the street in public places without a mask on. Joleen.
I think that Ninotchka's message actually translates to here in the US.
Yeah.
We have two leaders. Actually, even in the UK has more deaths of Philippine healthcare workers than the Philippines does. So with all these governments, these right-wing governments, we have to take care of each other. There's no way that these racists are going to take care of us. And I hope that for all the healthcare workers, please ask for what you need, including from us. Right. We have a role as your community in order to support the wellness of Philippine healthcare workers, as well as the communities you go home to. So I'm going to advocate for Ninotchka's message to actually go international. It's relevant.
Thank you so much for all that you do, ladies. Thank you for Kanlungan. Go ahead, invite our viewers to check it out.
Thank you. Please. And if you have any complaints about your facility, send it to us. Contact us. We will try to do something, believe you me.
I'm also hearing of people that are putting together funds, groups in order to help provide PPEs for the healthcare workers. You may also contact a firm through Kanlungan. Joleen, that's correct?
That's correct. We support wholeheartedly all of those collections, but we also want to reiterate that it's the responsibility of the employers, of the hospital corporations, to provide that. Everyone is paying for their healthcare in this country. You have enough money to provide proper protective equipment for our families. So yes, and the GoFundMes are on, they're on the website for every single family member that has passed and has one out. But we also are prioritizing collective action because the money is there to pay for the equipment for all the workers.
With that said, what else can we do? For the viewers, what else can we do?
This is not a normal time. What we're seeing is the precipice of a new world emerging. And so my first call to everybody is to get organized. you have to join an organization, you have to join a collective. It can be a firm, it can be another one. Whatever social justice organization you choose, you have to be a part of something. We're not going to win any power as individuals. So before anything else, I'm asking you to please join a movement.
Again, would like to remind everyone that what you're seeing on TV, because TV airtime is limited, what you're seeing is just the sliver of the actual interviews that we're doing with all these wonderful, amazing personalities that are coming on either to give us information, to give us inspiration, to educate us, give us enlightenment, or simply to just be with us and talk to us during this time when we are trying our very best to give you guys accurate information, accurate news, culturally relevant stories, which is very important as Filipinos living in America, as well as helpful tools in order to survive and maybe even to thrive during this global pandemic. So please catch us on YouTube, youtube.com/Jannelle. That is on Wednesdays at 8 p.m. Pacific, 11 p.m. Eastern, and 11 a.m. Thursday morning. Be safe, guys. Practice social distancing measure, please. We have to take care of each other because we are in this together. Please wash your hands often and please wear that mask. Until next week, same time, same channel. I'm your host, Jannelle, and this has been So Jannelle.